What up, Vibers? It's your boy Kai. Welcome to another episode of the Vibe with Kai podcast. In today's episode, we're diving into something truly exciting: how to live longer and healthier. And who better to help us with that than today's guest, Dr. Jeffrey Gross. Now, Dr. Gross is a top neurological surgeon who has been recognized as one of the best in his field. He's worked in traditional medicine for years, but now he focuses on regenerative medicine. And so, just in case you're wondering about this, that means we're talking about the future of health here. We're talking about the future, where things are going for the future for all of you. He is the founder of Recelebrate, which is one of the best names. I love that name, by the way, which is a clinic that helps people heal and live longer without surgery. And his work has been life-changing for many people dealing with chronic pain or aging issues. So today, Dr. Gross is going to break down what regenerative medicine is all about. We'll talk about how it can improve your health, why it's different from surgery, and what you can do today to start living a better, healthier life. Plus, we're going to share some fun stories along the way. So, my friends, buckle up, get ready for an episode packed with tips to keep you alive and thriving. My friends, before we get started, the episode today is brought to you by Columbia University's Who Stands Up for Mental Health, October 16th at Gotham Comedy Club, hosted by me, Kairos Keenan Westcott. I'm beyond excited to announce that I am teaming up with Columbia University for the Who Stands Up for Mental Health event on Wednesday, October 16th at 6:30 p.m. at the iconic Gotham Comedy Club in New York City. This night is going to be magical, and yes, there will be laughter, but we're also talking about something very close to my heart, mental health. We're mixing stand-up comedy with an opportunity to support incredible work that Columbia University is doing to reduce the global burden of mental disorders, fight the stigma, and make evidence-based treatment more accessible worldwide. With that said, my friends, let's talk to our guest here, Dr. Jeffrey Gross. What's up, man? How are you? Happy day to you.
Thanks for having me. Happy Tuesday to you.
Yeah,
Yeah, it's great to be here. Thanks so much for having me on. This is great.
Absolutely, man. I'm super excited to sit and chat about this. We were talking briefly before we started how this is out of the types of guests that I normally have, this is a little bit different, which is really exciting for me because I was saying to you before, I love to learn, and I know I'm going to be learning a lot today. So I appreciate you being here, my friend.
I'm happy to be here. That's why I'm doing this kind of thing is,
Yeah.
I was turned on to regenerative medicine by my patients, and it has been such an eye-opening sort of second round of medical education and now application for people. And I want to share that. I want to share what's available because it's not just the future, it's the present. And
it's the right now.
Yeah.
Absolutely. I want to dive right into this because I think this is fascinating. So your medical journey, it began in traditional neurosurgery, and then you ended up transitioning into longevity and regenerative medicine. What point made you decide to make that shift? Was there something that's specific that happened that you're like, you know what, I'm going to change course a little bit?
There were a couple things in the recipe, ingredients that made it happen. But, as I alluded to earlier, I was practicing neurosurgery. I did a lot of spine work. My background was mainly taking care of people with neck and back problems, all the way from therapies to injections to surgeries. And so many of my patients were in that gap where they had a problem and therapies wasn't enough. Injections didn't last very long. They didn't want the pills, and that's good. But the only thing left on the menu was surgery. And they're like, yeah, not quite as that bad. I don't want the surgery. And we agree with them. Like, yeah, you're kind of not. You're in that limbo. And so they would say, well, how about this? How about lasers, doc? How about crystals? How about stem cells? Yeah. And, you hear it enough times, like getting over, bonked on the head with a wooden mallet. You finally go, okay, yeah, maybe what about those stem cells? Luckily, chance favors the prepared mind. And my undergraduate years were in molecular cell biology, which is sort of the field that deals with this. And, I went to med school, I got busy, and I missed all that cool science. I'm like, oh, maybe I should go back and see what's happened in all those years. A few years might have passed by me there. So one year, instead of going to the, routine neurosurgery conference, where a bunch of guys in bow ties pat themselves on the back.
I was going to say, that sounds like a fun time. That sounds like a good
oh, that's a good time. Yeah, that's a real good time. But same old, right? They're doing the same. They're publishing the same things about techniques that have been done for 50, 60 years. Maybe there's a new approach, way to do it smaller, but it's the same thing. And I looked around and I said, I'm going to go to something else this year. So I started going to stem cell conferences and regenerative medicine. I'm like, hey, a lot's going on here. And I got
Right.
retrained, I re-educated, and I tapped into people that have been doing it and sort of did like mini fellowships. And then this is about 6, 7 years ago. And I started saying, I'm going to add this to my practice. It's going to be a new tool for my patients with neck and back trouble. But the real switch was it's more than that. So I started seeing people with knee problems and ankles and shoulders and organ problems and inflammatory problems and degenerative issues and people who just want to fight inflammation and be preventative and stay younger, and the biohackers in the crowd, me included. So
Right. Right.
so it just blossomed. It's not everything, but it's almost everything I do now, and that's kind of the journey.
Right. It's really exciting because so like have been recognized by multiple prestigious institutions and all of that. But I would imagine that this is for some reason just not like a widely accepted thing for some. Like I feel like it's just not like. Do you get pushback often when you like talk about these methods? Like are people like, oh wait, hold on a second? Like especially from colleagues of yours or people from
Yeah.
your background. Do people push back?
Yeah, there are two main answers to that. One is from a lot of myths that are out there,
Yeah,
and
I'm
and I
sure.
could probably list them off for you. First of all, oh, isn't that illegal? And we deal with what's legal and not legal and what that means.
Hmm.
It don't have to leave the country, and we deal with that. And oh, aren't those from babies unethically, immorally, being harvested? No, and we deal with all
Right,
those
right,
things. And once we, get to the real facts and the real what we can do, and we share all that, that handles the myths. And then there's, oh, but my doctor said that's not ready yet, and so
mm,
there are a lot of. And I said, you know what, I get it, because 8 years ago, if you had asked me that question, I might have said the same thing.
right,
And they go, oh, I see.
right,
you
right,
know,
right,
so those are usually two main groups of issues that I do. That's the pushback, and it's easily dispensed, easily dealt with.
right. And I think there's probably a lot of misconceptions to it because it's regenerative medicine. It's still kind of like a mystery for a lot of people. So if you don't mind, could you explain in layman's
Sure.
terms how stem cell therapy works and why it's considered so
Yeah.
transformative in the medical field right now?
Yeah. Let's do that, because I'm here to educate, and people should know what regenerative medicine is.
Hmm.
And we use that phrase stem cell medicine, but stem cells are only one aspect of it.
Sure.
Um, so regenerative medicine taps into a strategy that has helped our bodies and our species for forever, and that strategy is that some of our cells exist to create us, to make us into a person, help us grow, and then help us replace damaged or older tissues and cells, and help us heal and repair. And that's through a process of regeneration, and we're doing that all the time, whether you think about it or not. You make new
Right.
liver cells, you make new skin cells, lots of others as well. And if you hurt yourself, you cut yourself with a knife accidentally, there's a whole cascade of activities at the cellular level that
Right.
call for regenerative growth factors in cells. And this is now a medical strategy. Well, we've learned from that. Let's take it and use it to our advantage. So you have things like PRP, which stands for
Hmm.
platelet-rich plasma, which can be used in many different settings, usually orthopedic, tennis elbow, things like
Right.
that, where you take your own blood, you spin it in a centrifuge, and you take off the growth factors and you reconcentrate them in an area of need. And then there are stem cells, which you can take from your own body or from a donor who just had a baby by C-section. Congratulations. Hey,
Hmm.
by the way, we were going to throw away your placenta, umbilical cord, and
Right.
amniotic fluid. Can we have it?
Can we keep
And
that? Do you mind
yeah,
if I
and
keep that in my
that's
closet
how
for a
it's
little bit?
done. That's
Yeah.
there's a whole donation process and a tissue
Yeah.
bank certification. It's done right, and
Right.
and then even beyond that, we now have all kinds of cell signaling and stem cell derived um, factors or cell to cell communicators called exosomes. So
Hmm.
so we really have many ways of and that's just scratching the surface. There's more coming.
Right. Right.
Many ways of applying regenerative medicine to help someone, whose body cannot repair them adequately anymore or at all.
Right. How much has the technology and the like how much has that improved just over the past like 5 years? Is it starting to like scale up at a point that the technology and the discoveries are coming faster
Yeah.
now than ever before? Is that what's happening?
Yeah. I mean, if you search, if you go on Google and you search PubMed, which is where a lot of the, publications are sort of indexed, you know, and you put in stem cell, you could, and you search it for certain time years, you'll see how it's escalating
Mm,
exponentially compared to 5 years ago and 5 years
mm.
before that. So,
Right,
so the
right.
research, and that's just the research side. The application, of course, is lags behind, but is coming as well. There are many more clinics and doctors. I'm not the only one,
Hmm.
Kai. There are lots of us.
Right, right. I want to talk for the people, well, not for the people, but to the people that are dealing right now with chronic pain, health issues, that may be listening to this being like, okay, I want to know more about this. So let's just say they're dealing with chronic pain, health issues of some sort. What criteria should they consider when choosing between traditional surgery and the regenerative treatments that we're talking about today? Like, how does somebody come to the conclusion of which way to go?
Well, everyone's an individual, so you have to look
Yeah.
at all your options and you have to get multiple opinions. If you're looking at a surgery, you should have multiple opinions.
Hmm.
And one of those opinions should include regenerative medicine. So,
Hmm.
are there any stem cell options? Are there any regenerative options to help me short of surgery? Because surgery has risks,
Right.
and it has, it's not without downtime and pain and missed work
Hmm.
and pain pills and all that. So if you can
Right.
avoid all that, and why not try something much less invasive like an injection or something?
Right.
Um, as long as there is a logical target and some good science to back it up, because we don't
Hmm.
just throw stem cells at people to see what happens.
Right.
We
That's not how it
we
works.
yeah, well, there are places you can get that.
Right.
But everything we do is based on good published science and clinicals
Yeah.
somewhere, and we're late to the party here in the U.S. So a lot of the literature comes out of Europe and Asia and what have
Right.
you. They're ahead of us for sure, and that's why you used to hear about athletes, leaving this country and going, Tiger
Right.
Woods and Peyton Manning, and
Right.
Kobe
Right.
going
Aaron
going to Europe and
Rodgers.
stuff.
Yeah.
You don't have to do that anymore. We have it here.
Right. Right. There. I remember when I was doing research on this and just kind of reading like both sides of the ideology here. I saw that there were a lot of skeptics, right, that were arguing that they were saying things like stem cells, the regenerative effects of stem cells are exaggerated or unproven, that kind of stuff, and that kind of goes into what you were talking about, just
Yeah,
now. How do you respond to
yeah.
those concerns? Like,
No,
I know you
let's
were just talking about the data and the scientific side of it. Like, where
yeah.
can people find this information?
Yeah, let's dig into both of those, maybe separately. So
Yeah.
I'll take exaggerated first. There
Hmm.
are a lot of people who do exaggerate what can be done with stem cells or what
Hmm.
they can do with stem cells.
Right.
So make sure that you get opinions from people who know what they're talking about, who can say, "Here's what this is based on. Here are my expectations. Here are some similar stories." Because here in the U.S., we're not allowed to make marketing claims
Right.
using
Right.
regenerative medicine. So
Right.
we want to be upfront about that too. So if sounds too good to be true, and it's not targeted exactly for what you have and what you need,
Hmm.
then we're just going to give you this IV and you're going to be better.
Right.
That's maybe not the
Right.
correct
I
thing.
think I feel like that was like the one of the major concerns because like since it is so new and like some of the research just isn't like readily available, even though I mean we have the internet, so like,
It's
but like
available. We just
like
yeah,
how do we know what to how do we know what to trust, what source to go to? Because
yeah.
sometimes these people that over exaggerate it, like they talk a really good game, right? Like they're salespeople. They talk a really good game, and they're
Oh, yeah.
really good at encouraging people and persuading people. Like, and I'm glad that you're talking about things to kind of like look out for, kind of like the red flag kind of things, because I think that'll help people understand, which
That's
direction to go
completely
into.
fair. If you feel like it's a sale, then it's probably a sale.
Mm-hmm. Mm-hmm.
So you make sure you feel cared for.
Right, right.
That's first and foremost. And if it sounds too good to be true, then then the person doing it is probably over exaggerating. I would
Right,
agree with
right,
you on that. And
right,
then the
right.
second part of your question, Kai, was about unproven,
Yes.
and define that. What's unproven? Because nothing in medicine is 100% proven. A lot of things
Hmm.
we do, when you go to your doctor and your cholesterol is elevated and they say, we're going to give you this medication to lower it,
Hmm.
that doesn't work on 100% of everybody. So it's not proven it's going to help you. The
Right,
word
right.
proven is misused, right? So you want to have what's called informed consent. That means
Yeah.
you know the risks, you know the benefits, you know the range of potential outcomes,
Hmm.
and that you have the education and tools to make a good decision with some help. So so make sure those, you don't just accept these vague words. Oh, that's
Right.
unproven, and
Right.
some things are,
Right.
some things don't yet have enough scientific evidence. Maybe some
Right,
things
right.
have some scientific evidence that's worthy of discussion as an option. So
Hmm.
I think you need to be reasonable. Anything that sounds unreasonable, either too good, which is
Right.
the over exaggeration, or too bad, unproven.
Yeah.
Those two extremes are there because someone has an opinion, a bias already.
Right, right. What are the things that I love about Recelebrate? Which again, I love that name. Like, did you come up with that, or just somebody? Because like
I
that's
I
genius.
did with the help of my wife. She's good at this stuff. So
What's your wife's name?
Lila helped me
Lila.
figure it
Thank you, Lila. Thank
out.
Lila. Thank you because that name is incredible. I love
Yeah,
that.
we
That's really
we
cool.
uh, we we do our brainstorms when we walk the dog at night, and that
Oh, that's
came to
you
us one
know,
night. So
I'm the same. Most of the stuff that people see that I post on my platforms, it comes when I'm either out for a walk. I usually go for a walk at night, or when I'm just kind of like it's always at night. It's like a late night idea that I'll just randomly get. It's never during the day for some reason. I don't know why, but anyway. So what I love about the Celebrate is that it emphasizes rejuvenating the body's own like symptom, like that's part of
yeah.
it. So how do those treatments differ from like the common perception of quote quick fix surgeries? How are those treatments different?
Yeah, so regenerative medicine through Recelebrate or anywhere,
Yeah,
seek to really help your body do the repair work that it should be doing or used to do when you were younger,
yeah,
or when you were a kid. Kids heal. They could fall down and hurt themselves,
hmm
and a few days later, it's all better, right? And
right,
and
yeah,
grandma bumps her arm and there's a bruise there 2 weeks later. So
yeah,
so it's very different. And we just, your body does the work, and
right,
regenerative medicine helps your body remind and get reactivated to do that. So
hmm
that's it. Now, quick fix surgery. Let's talk about joints. Okay,
yes,
joints are
please,
so all over the place. People hurt their
hmm
joints. We have a lot of joint problems in the world, in the country,
hmm
because we live longer and we do lots of things, and
hmm
and um, and joints are made of bones and cartilage, and the cartilage structure is kind of like the biological rubber.
right,
It's not super alive tissue. There's not a lot of blood flow. There's not a
right,
lot of cells. It's kind of like this protein rubber, this like chewy
right,
gristle. Think about hair. Hair is not cells, right? The cells that make hair are in your scalp, called the follicle cells. They grow this protein called hair.
right.
Well, your
How do
joints,
I get that, Dr.
yeah,
Jeff? How do I get those
the
things to come
little
back?
spiky things. Now, I didn't know you were going to shock us by taking off your hat. uh, but that's a whole conversation. We can come back to that in a minute, because it
Yeah.
requires the full body anti-inflammatory approach, which
Yeah.
we should talk about,
Yeah,
because
sure.
that really is the essence of anti-aging and disease slowing.
Yeah.
But the joints, the cells that make the cartilage protein, they're in your bone. They're in your growth
Hmm.
plates of your bone edge, and over time, exposure to what's in the water that shouldn't be, what's in the food we shouldn't be having, what's the pesticides, the electromagnetic fields, the who knows what.
Right.
Our body's so busy fighting that stuff that certain cells are more sensitive and they get inflamed. And the inflamed cells can't do their job. So that's called osteoarthritis. It's a metabolic problem of the cell function in the bone edge. So we reactivate those when we have proper targets, as we identify an MRI that we can correlate and match up with pain. So if you have, like, I have this knuckle that's killing me,
Hmm.
and we do an MRI, and we find, oh yeah, look, it's inflamed in the bone edge. We actually inject the bone, which, does that sound painful? Yeah, kind of, but we do it under a
Hmm.
little sedation, little
I
numbing.
would certainly hope so, because I just cringed just thinking about that. Oh my goodness.
You should, yeah. But this has been demonstrated over 15-year follow-up studies in
Right.
France to be superior to injecting the cartilage, because again, the cartilage is sort of like, if I took some stem cells and rubbed them in your hair, it's not going to do much. But if I
Hmm.
inject them in the scalp, now you have a chance of regrowing some hair, because we're
Hmm.
stimulating the follicle cells and we're suppressing, the way regenerative medicine works, it suppresses this inflammation, this inflammatory activity that causes accelerated aging and
Hmm.
increases the development of inflammatory diseases,
Hmm.
aka diseases of aging. So that's the
Right.
whole basis of anti-aging, is slowing inflammation. So if you
Hmm.
can use regenerative medicine to do that, that's a great biohack.
Right. That's okay. So I mean, I'm okay for now. I think bald is beautiful. So
You look
I'm gonna
great.
keep it
Yeah.
for now. But I want to give you a hypothetical situation here, because I know that some people are trying to, like I jokingly talk about like my hair, or lack thereof. But there's injuries that I've had in my life, and I know there's people watching or listening right now that have had injuries as well, that are like putting themselves into this situation. Like, okay, maybe I should have done this, blah blah blah. So I'll give you a hypothetical. Well, it's not even hypothetical. It's like something that happened to me, and I'm curious what your thoughts are. So, in 2018, I was playing basketball, ruptured my Achilles, complete rupture, not fun at all. It was god awful, right? And obviously I went in for surgery, and like it's all like healed up now. What are some options that I, as an athlete, would have had in a situation like that? Like obviously the surgery would have to be done because it's not just going to automatically reconnect itself, right? But like, what are if somebody came up to you, if I came up to you and told you, "Hey, I'm currently recovering from a ruptured Achilles," what is that conversation like?
Well, you don't have to have surgery if it's an acutely ruptured Achilles. There are options,
Hmm.
if it's not retracted, meaning pulled away,
Hmm.
where here's, let's say this is your leg, and this is your
Yeah.
foot, where you get in, put into a kind of a fixed boot thing that keeps
Hmm.
your foot flexed down
Hmm.
and lets the Achilles touch and
Right.
start to reconnect. And over time, as you're healing, the doctor slowly gets your motion back, and then you do physical therapy.
Hmm.
That's a long road, right?
Right. Hmm.
Surgeries, actually, for certain things, there's still a role for surgery. I'm not here to replace all surgery. I
Right.
hope
Right.
to diminish surgeries and delay surgeries, but there are some things that just have to be trimmed or have to be cleaned up or have to be reattached. But regenerative medicine could speed that recovery, and I believe we
Hmm.
have examples of that with pro athletes who have had Achilles.
Yeah, I was gonna. Is that what Aaron Rodgers did? Because I know
He had, I
he
think, an
ruptured it.
ankle. I don't know if it was Achilles or his ankle, but he did lots of
Hmm.
different things, and
Yeah.
peptides, and which
Yeah. Yeah.
we do use strategically as well. But the it's, a regenerative medicine augmentation, adding that to the mix,
Yeah. Hmm.
might benefit and accelerate the recovery. Delivered locally, delivered IV, both, maybe repetitive.
Hmm.
You know, that's one approach. If it
Right.
is a partial tear or or a cartilage degeneration, which is sometimes called bone on bone,
Hmm.
eventually, or you know, um, osteoarthritis. Some people come home and say, "Doctor says I have arthritis." Those are people we can really help. We have great
Yeah.
befores and after MRIs showing restoration of the cartilage,
Mm.
letting your body turn back on those cartilage factory cells and make more cartilage.
Hmm. Is there like an age limit, or is it just for all ages?
No, I mean,
Yeah.
listen, if you're much older, you have a lot of inflammation in your body, a lot of disease processes, it's going to take longer and take more. If
Right.
you're more bone on bone as opposed to just some early degeneration, it's going to take more. It's going to take more time.
Right.
But that doesn't mean all hope is lost, because even people 100 years old have stem cells, and those
Right.
stem cells might be dormant or they're
Hmm.
inflamed and just not doing their job. They just need some love to be reactivated.
Right. It's funny because we're sitting here chatting about this, and like I'm like it's all good things. It's all logic. It seems like very logical things. So Doctor, why is it what like you were mentioned before how we're behind the eight ball here in the United States, and there's other countries that have been, really researching this and more accepting towards it. Why is the United States so reluctant to take this on, and why are we so behind?
I'm going to go out on a limb here. So
Mhm.
if you don't hear from me ever again, and I'm found buried in a desert, it's because follow the money, right? There are
Yeah,
political and
yeah.
economic
I was going to say it's
factors.
probably political. Yeah.
Yeah, I mean, big pharma
Hmm.
is just starting to get their fingers in it. That's probably what will bring it to the table because
Yeah.
they control,
They see that where the money's at,
well,
probably.
there's the regulatory piece that ties into that.
Yeah.
I'm going to say
Yeah.
that very cautiously. And then
Hmm.
there are companies that make knee replacements and spinal hardware, and they that's a multi-billion-dollar industry. And
Hmm.
if we can cut down the number of surgeries by 50%, um, that's a big hit to the bottom line.
Right. So, what is your role here? So, like, what do you want your role to be as this is continuing to grow and people are becoming more accepting of it? What is your role?
Yeah.
What do you want? What do you want your role to be with
a
this?
couple a couple things if I'm allowed to choose more than
Yeah,
one.
please,
Okay,
absolutely.
so first, I really want to educate. I want to get on shows like yours, Kai, and
Hmm.
tell people it's okay to ask and keep asking,
Hmm.
and see if there's an option for you before you do something that might be tried and true because it's been around for 50 years, but it may not be the best thing. um, it may not be the latest thing. It may not be the only thing. So I
Right.
want to explain how it works. I want to explain, and as one of my favorite professors would say, demythologize.
Hmm.
Take away the myths about it. So we want to do
Yeah.
that. And then on my part, I want to push the envelope. I'm using what's available now is just kind of generic regenerative medicine biologics. We have stem cells, we have the stem cell derived exosomes, but I'm working on projects to get specialized ones. Some from the signaling from the immune cells that are known to go through the body, identify and remove abnormal cells like cancer cells. So think about that as a augmentative treatment and or preventative. And then we have other, exosomes that are chock full of mitochondria. So as you're getting older, you're losing muscle mass. Knowing that muscle mass correlates with longevity and health span,
Hmm.
we might be able to use these strategically to help maintain muscle mass or help athletes recover from an injury or things like that.
Right, right. I really like. I think this is really cool because, like, even for me, there was a general ignorance that was there because I just didn't know how this could help, right? Like I just didn't, and I know there's a lot of people that are listening and watching right now that are learning this, along with me, and I want to talk about the insurance side of it, right?
Yeah.
Just a little bit, because I know that insurance doesn't normally cover this type of treatment. So, how do you see that changing in the future, and how can potential patients navigate this challenge now?
Yeah. So let's talk about insurance coverage for a minute. So, and you say insurance, but what you're really talking about is hundreds of different types of coverages and plans out there, from
Sure.
governmental ones to private, although the private ones have largely allowed the government rules to water them down.
Right.
So funny thing is, none of the regenerative medicine treatments have been approved for marketing claims by the FDA. So you cannot advertise. I can't advertise on Google. I can't advertise on Facebook.
Right. Right.
Uh, uh, but what happened is the people running some of these private insurance companies have figured out that uh, a couple PRP injections is a lot cheaper than a surgery, and the
Mm.
efficacy is there. They're starting to see some benefit. So they actually started covering the treatments. So a lot of insurances now will pay for PRP, and I
Mm.
think moving that to stem cell treatments and to other regenerative biologics is a matter of just time, and let the bean counters and CPAs look at
Sure.
it enough and go,
Sure.
yeah, we're going to save some money here, and since
Hmm.
we're all about making a profit, that's
Hmm.
more important than what's approved and what's not for marketing claims.
Right. Right.
So I
Right.
think it's coming, and people do use health insurance. They use, I recommend they during open enrollment they sign up for the high deductible HSA or health savings account plans if they can, and you
Hmm.
can use that money any way you want, either a flexible
Right.
spending or a health savings element to your insurance. You get control of that. You can have massages, you can have acupuncture, you can have regenerative medicine.
Hmm.
And then, and from a cash perspective, because the stem cell derived exosomes are so voluminous because they come from the amniotic fluid, they are about less than half the cost of the similar stem
Hmm.
cell procedure with what appears to be at least the same benefit, if not better. There are
Right.
some
Right.
advantages there too. So the costs have come way down. I mean, we were able to offer this to people, who are able to figure it out. So it's doable.
Right. Now, obviously, you know me, my entire platform is all about the mental health aspect of
Right.
things, and I'd be remiss if I didn't, bring that up here. To your knowledge, what what if any are the mental health connections here for people to consider?
Well, listen, a lot of mental health, comes from, having too much inflammation in the body.
Sure.
We know that there's an axis between the gut and the brain. That's why probiotics, can help reduce inflammation at the gut level. It helps the brain, modifies the neurotransmitters back to what would be, we'll call a happy balance.
Hmm.
And there are a lot of strategies both through regenerative medicine and certain peptides and something called nootropics, nootropics, which are certain peptides, medications, or supplements that can
Right.
help improve the balance of neurotransmitters, which eventually can improve mood. Now, this is not a strategy by itself, right? You still have to do all the mindfulness and meditation and removing
Right.
toxic relationships and all that
Oh
stuff too.
yeah. Sure.
Right, right.
Hmm.
It's like you got to
Right.
remove the thorn in the tiger's paw still,
Right.
but but
Hmm.
these things are all strategies to help optimize uh, the the part of the brain that works the mind and the
Right.
mood.
Yeah, I'm asking because I'm very curious because I know a lot of people that follow me are therapists, are mental health professionals,
Yeah.
and things along those lines. What would you like? What would you say to them right now that as they sit and talk with a lot of potential patients? What would you say to the therapists and mental health professionals that are listening right now?
I'm going to go out on a limb again.
Hmm.
I seem to be, barely balancing out here on these limbs today, but I want to be open with you. I would say different things to psychiatrists than I would to psychologists.
Sure.
And when you said therapist, you sort of left that open for me, so I took both.
Hmm. Yeah, that's fine.
To psychiatrists, I would say use more talk therapy and fewer
Hmm.
pills if you can. I
Hmm.
realize that's not, there's always someone who needs something, right?
Sure.
And for the talk therapists, for the psychologists, I would say let's bring in more preventative wellness, and we call this the epigenetic lifestyle modifications, right? The
Hmm.
anti-inflammatory lifestyle to help reduce the neurostress, which is another source of inflammation, because inflamed neurological tissue puts out the wrong stressful signal, the wrong neurotransmitters, and those people are always anxious and therefore depressed,
Right.
and that gets in a cycle. And you ask anyone that the top two diagnoses are anxiety and depression in this world. So
Hmm.
so we all need to work towards that. So look at other strategies, exercise, a clean diet,
Hmm.
maybe intermittent feeding or intermittent fasting,
Hmm.
um, hormone replacement. We see a lot of men and women with declining hormone levels earlier in life, and with that goes their mood and their mental health. So, in addition to whatever provocative problems are going on to cause those in the first place, whether it's deep
Sure.
seated trauma from
Right.
the past that needs to get woken up and demons removed and all that.
Right.
So, there's a lot.
Right. Best case scenario, 5 years from now, everything goes according to plan. I said that very like an evil doctor. Everything goes according to plan. Like so,
1 million.
yeah, right. So let's just say best case scenario, everything is going in in a direction that you're like, hell yeah. Where do we sit 5 years from now when it comes to this?
Well, sadly, we don't move as fast as I like, but
Hmm.
I think we probably have probably 5 or 10 times the number of physicians who can speak to stem cells, even if they're not doing it, or regenerative medicine, and know someone that is, so they can refer patients, so they can get an opinion and find an option. Because the people that seek me out already have an idea about stem cells, or something, right? It's the people that have no idea, that go to their doctor, trust their doctor, and their doctor was trained 30 years ago, like me, and haven't come off that training. That's all they got, and it's a long time has passed. You think about computer technology and AI and chips and Moore's law and all those things, and how exponentially fast they develop. But medical science is not moving at that pace, and part of it's highly overregulated, and then highly the economically drained by middlemen, by third-party insurers. Where I struggle to call and fight for an MRI for one of my patients, who's paying their premium every month, but someone's got $100 million bonus they got to take care of on the other end. So
right. So just to kind of start wrapping this up, because I this is really, really fast. I
think you're just starting. Really cool. This is just opening this up.
That's I can't. I need to have you back on, because I have so many more things here. But for the people that are listening right now that are like, okay, Dr. Jeff, I'm sold. How do I do more research on this? If somebody's curious and they want to do some of their own research, they want to take some of their own steps to learning, how they can help with their chronic pain or some of the issues that they may be dealing with physically, what are the next steps that they should take after listening to this podcast?
Start very simply. So, open an internet browser, type in your symptom, knee pain, stem cells, and where, the city where you live, Philadelphia, whatever, and see what comes up, and start clicking on clinics and stuff near you, and see what's there. And then after you've done a little, there are some places near me, then add the word to your search terms, PubMed, so you can see what, take out your city name, put in PubMed, and see what research and publications are out there. And you'd be surprised. There's we're waiting for 20-year follow-up publication in France on some of the joint work we do. And they've been way ahead of us. And you don't need to go there to get it now. We can do it here, but they've blazed the trail for us.
Mm-hmm. That's amazing. I love that. And if any of you that are watching or listening right now you're just like, okay, I'm ready to go, I'm going to include a lot of this information in the description of this podcast episode. So all you have to do is click. And also the blog post that's going to be accompanying this episode will also have some of this information in there as well. So all you have to do is go in there, read through everything, and it'll give you some more direction. You'll learn more about this. You'll learn more about Dr. Jeff. You're going to learn about Celebrate. You're going to learn about everything. I'm making it easy for you, my friends. It's all going to be there for you. Dr. Jeff, if just to kind of number one, I'm going to have you back. I hope you know that. I hope you're okay with that.
I'm your phone a friend for this anytime you need.
I love it. And what I'm probably going to do is I'm going to ask any of my listeners if they have any specific questions, and maybe next time we could do like a Q&A kind of thing,
totally.
And answer some of the questions. If you could leave the listeners and the people watching with one piece of advice when it comes to maintaining their health and their vitality, well throughout their years, what would you tell them right now?
Yeah, you're teasing them, because I'll give you one, but I got like 25 of them. So, the basics is this: keep moving. Your muscles, when you use them, release small peptides called myokines, and those myokines help your health. They help your organs function. They help your brain, help prevent dementia. So the more you move and the more muscle mass you have, the longer and healthier you will live.
Mm-hmm. I'm glad you said that, because I was going to ask what if there are some daily habits or lifestyle changes that you could recommend for people, and keep moving is a great one. What's another one that people can
protein?
Okay.
I will estimate that 9 out of 10 listeners to your show and every show are not getting enough protein, and good protein for that reason.
Yeah.
So we are protein based. We are nitrogen based animals. We are not carbon based. Carbon just carries our proteins around. So we are
Right.
protein based. You got to have your nitrogen, your protein. So whether that's through, you want to do it through fish or meats or others. Vegans really struggle to get enough. You got to eat a lot of lentils to get that protein. So protein
Right.
supplements, vegan friendly protein supplements, protein drinks, protein powders, while not getting too much sugar or carbs.
Right. Right. I feel like we're just this is the tip of the iceberg,
It
Dr.
is.
Jeff. This is the tip of the iceberg. So I'm definitely going to have you back. Where can our audience learn more about you and Recelebrate?
So Recelebrate is RECELLEBRATE, because you're celebrating the renewal of your cells. But so there are two L's on Recelebrate there. You can find our website, recelebrate.com, Instagram, Facebook, LinkedIn, Pinterest, YouTube. Just type in Recelebrate, you'll find us. I think we're the only
Absolutely.
place using that word, and we made up the word.
I know, and it's great. And again, my friends, if you're listening, I'm going to include all of that information, all their social media handles, all the websites, all the URLs. It's all going to be in the description of this podcast. Dr. Jeff, thank you so much for
Thank
hanging
you.
out with me today. Honestly, it really does mean a lot. Thank you. Where are you based out of again? Are you in California?
We're in Las Vegas,
Las
Nevada. I used to have an
Vegas.
office in California. We closed it because California's falling off the face of the map. But sorry, California.
Quite literally, yeah. Quite, like it really is. That's so funny. No, I've been to Vegas 7 times, and I have a great time every time I'm there. So next time I'm in town, I'm gonna hit you up. We'll do lunch or something. Okay.
I'd love it.
Awesome, cool. Thank you, Dr. Jeff. To everybody listening right now, again, all of that information is going to be in the description of this podcast. Thank you so much for listening and for watching. As always, much love, good vibes, and I will talk to you later, friends. Bye-bye.